After several days of anticipation, the long-awaited Congressional Budget Office's score of the Republican-passed American Health Care Act was released. 23 million will lose their insurance, and the plan will significantly increase premium costs for the sick and the elderly. According to the CBO analysis, the House bill also would raise premiums by 20% next year and 5% in 2019 before decreasing after that. Medicaid expansion under the ACA discarded categorical eligibility, where low-income individuals only qualified if they were pregnant, a parent of a dependent child, over age 65, or had a disability in favor of criteria exclusively based on income. The CBO noted the House bill would mean 23 million fewer Americans would be insured than under Obamacare by 2026, CNN said. The CBO estimated that a 21-year-old making $26,500 would have premiums between $1,750 and $1,250 depending on if their state applied for waivers. While I am in favor of repealing Obamacare, I am opposed to the American Health Care Act in its current form, Republican Senator Dean Heller said in a statement. Portman represents one of the 52 GOP senators who will have to modify and vote to pass the American Health Care Act, a tall order given the bill's contentious nature. The Washington Post explains what would happen to states that roll back protections on pre-existing conditions and waive requirements for essential health benefits. The report said that under Obama's law, the nation's health insurance market is expected to remain stable in most areas because federal subsidies to millions of consumers largely rise with premiums. Over the long term, the biggest impact on access to health insurance and health services in Wisconsin would probably come from changes that AHCA seeks to make to the fundamental structure of Medicaid, which now provides health care for almost 1.2 million Wisconsinites. While stupefying, the figure is a hair better than the first incarnation of the GOP health care bill, which the CBO estimated would have left 24 million people uninsured by 2026. However, the CBO concluded that under the AHCA, less healthy individuals, including those with pre-existing or newly acquired medical conditions, would be unable to purchase comprehensive coverage with premiums close to those under current law and might not be able to purchase coverage at all. This really is about the federal government saving money, cutting the money that they give to states for care, and then taking that money and turning around and providing a tax break to very high-income people, the insurance companies, pharmaceutical companies, he states. I'm not astonished at that, said Sen. CBO said states adopting those waivers could destabilize coverage for people with medical problems. At the same time, under the AHCA, insurers could charge older Americans premiums that are as much as 5 times higher than those paid by younger people. Moran said a health care reform plan should allow more competition in the market, allow people to buy insurance from coast to coast, expand support for community health centers, and provide continuing support for medical research. Pre-existing conditions are in the bill, he said.